Hello everyone, I am Sandra May Ibranyola from BSN 111A, and today I am going to perform and show you in assessing the patient's posterior and anterior thorax. This evaluation of thorax is an essential component of a physical examination. The traditional systematic approach of this procedure involves inspection, palpation, percussion, and auscultation of the both anterior and posterior thorax. So this assessment helps us determine the patient if he or she have any abnormalities. So prior to the procedure, I am going to check first for the patient's medical record if available and determine the scope and assessment needed for it is done to know the extent of the physical examination. Now we will going to prepare for the necessary equipments that we need during this procedure. First, we have stethoscope, the lab gown for the alternative patient's gown, and a marker. So, prior to the procedure, I am going to close the door. Ensure adequate lighting for patient comfort and verify your identity, introduce myself, and of course, let's not forget to do a hand washing. So, let's go. Good evening, ma'am. I am Sandra May Ibranyola, your student nurse for the day. Kindly please state your complete name.
Mrs. Diana Roda.
Your birthday and civil status, please.
January 6, 2004. I am single.
Okay, thank you very much, ma'am. But before proceeding, may I ask what should I call you?
Diana Defines.
Now, inform the client or patient about having a thorax health history. If he or she may have experienced respiratory health conditions, these information will help us to give a more accurate respiratory assessment. Okay, Ma'am Diane, I am going to assess your thorax, which means in this procedure, I am going to touch your upper extremities, and there are some movements that I need you to follow. Is that alright with you?
It's alright, miss.
Okay, so there are some questions and I need you to answer truthfully. Okay?
Okay, nurse.
Okay, so let's start. In any chance, do you feel chest pain?
No.
Do you observe difficulties when you're raising your breath?
No.
Or have you been coughing these past few weeks?
No.
Okay. So perhaps do you have troubles when doing inhaling and exhaling?
No.
Okay. How about in your family? In any respiratory disease?
No.
Do you have any allergies with the food or medications?
No.
Okay. Do you have any, how about your family? Does anyone have been smoking?
My father used to smoke the last few years.
Perhaps do you engage yourself in smoking too?
Definitely, it's a no.
Okay. Do you have any relatives who have lung disease?
No.
Okay. So, do you have a strict diet and have you been sleeping well?
I have been sleeping well and I don't have a strict diet.
Okay. Thank you very much, ma'am. Don't worry, these informations that I have gathered will be secured and will be passed on to your doctor. Do you feel comfortable with our setting?
Yes, I do feel comfortable.
Okay. Before proceeding, do you have any clarifications or questions?
None.
Okay, so let's start the assessment. So, in surveying the chest and respiration, check for any signs of respiration distress and problems with their oxygenation. And observe for the color of the face, lips, and fingernails. Then I am going to palpate for the suprasternal notch and note for the position of the trachea. Okay, Ma'am Diane, can you inhale and exhale for me? Do it one more time. Okay, thank you. So now I'll be observing the color of the face, lips, and fingernails. Okay, can you turn your head to your left side as I palpate for the trachea? To the opposite side. Okay, thank you. In examining the posterior thorax and lungs, I will instruct the patient to stand up with their arm by her side and stood behind from the patient and observe for the position of her scapulae as well as for the shape and configuration of her chest wall. Okay, Ma'am Diane, can you stand up and face to the opposite side? So, in inspecting for the spine alignment from the lateral position, I will observe for the curvatures, which is the thoracic, cervical, and lumbar. Okay, so to assess for the spine division, I will instruct the patient to bend and I will observe from behind. Okay, Ma'am Diane, can you bend forward? Just like you're trying to tie your shoelace. Okay. Okay, thank you. You can now stand up. And the third one, to palpate for the posterior thorax to assess the client's temperature and skin integrity of your chest wall. And I am going to palpate for all the areas of thorax to check for any signs of bulge, tenderness, and abnormal movements. So I'm going to unhook your bra. Okay, Ma'am Diane, can you inhale and exhale for me? Do it again. And again. Okay, thank you. Okay, so I can now sit down. Fourth is to check for respiratory excursion by palpating the posterior thorax. Then I'll ask the patient to take a deep breath because I'll be watching my hands for any signs of loud movements. Okay, Ma'am Diane, I need you to inhale and exhale for me. Okay. Do it again. And again. Okay, thank you. So, to palpate for the thorax or vocal fermitus, I'll use the palmar surface of my fingertips. Then I ask the patient to repeat the word 1, 2, 3. And to not forget to repeat the steps while moving hands sequentially to compare the fermitus of the both lungs. Okay, Ma'am Diane, I need you to repeat the words 1, 2, 3 as I percuss or palpate your thorax. Is that okay with you?
It's okay.
Okay.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay, thank you. So, to percuss the patient's posterior thorax through having the patient to bend their head forward a little bit and fold their arms forward across your chest while percussing the intercostal spaces about 5 to cm in order for me to compare each side of the lung. Okay, Ma'am Diane, I need you to do this. Okay, so as I percuss your posterior thorax. Okay, thank you very much, ma'am. So the seventh step is to use percussion to measure the diaphragmatic excursion in order to determine the diaphragm level as well as the excursion. I'm going to ask the client to take a deep breath and hold it in for me to measure the distance between the expiratory and inspiratory levels. Then repeat the process on the opposite side. Okay, Ma'am Diane, I'm going to mark your back using this marker, as well as asking you to inhale deeply and hold it in for a second. To the other side. Okay. Okay. Okay, thank you. Now for the eighth process or procedure is to auscultate for the breath sounds by placing the diaphragm of the stethoscope firmly and directly into the posterior chest wall, and ask the patient to breathe deeply through the mouth to each auscultation process. I am going to listen at each point of the breath sounds during a complete inspiration and expiration through the use of the systematic ladder. Then I'll be comparing the findings of each point and note for the location of the chest wall for any signs of adventitious sounds if heard. Okay, Ma'am Dayan, I need you to inhale and exhale for me if I say so. Okay. 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 Okay, so thank you for that, ma'am. So for the ninth procedure is to auscultate the voice sounds following the same pattern that we did earlier. Okay, so to do this, I'll ask the patient to repeat the phrase 99 while auscultating the chest wall. Okay, Ma'am Dayan, I need you to repeat the phrase 99 as I'll auscultate your chest wall. Okay?
99. 99. 99. 99. 99. 99. 99. 99.
Okay, thank you. Then repeat the letter E for listening, for I'll be listening over your chest wall, okay?
Okay.
Okay.
99.
Letter E.
E. E. E. E. E. E. E. E.
Okay, so lastly, I need you to whisper the phrase 1, 2, 3 as I'll auscultate your chest wall. Okay. Okay, thank you very much for that, Ma'am Dayan. So now let's proceed to assessing the patient's anterior thorax, such as inspecting for patient's breathing patterns, as well as inspecting for the costal angle in the intersection of costal margins and the angle in which the ribs enter the spine. Okay, Ma'am Dayan, I need to palpate your chest. Is it okay for you to touch your chest, for I'm going to observe for your breathing patterns?
It's okay, nurse.
Okay. Okay, so now let's proceed to palpate the anterior thorax, specifically for the respiration excursion of tenderness, sensation, surface masses, scriptus, and firmitus through placing both of my hands on the lower thorax. Then I'll ask the patient to take a deep breath while I'll observe for the movements of my hands. Okay, Ma'am Dayan, kindly take a deep breath. Okay, again. Again. Okay, thank you. So now I'm going to percuss the anterior thorax systematically through percussing above the clavicles in the supraclavicular space, then proceeding downward to the diaphragm and compare each lung. Okay, so the last part is to auscultate for the anterior breath sounds and adventitious breath sound and voice sounds. First, I'm going to auscultate the trachea, then the anterior thorax by placing the diaphragm of my stethoscope firmly and directly on the anterior chest wall. Then I'll be going to auscultate using the systematic pattern again. So, Ma'am Diane, kindly take a deep breath as I auscultate your chest. Don't forget to listen for the normal sounds and adventitious breath sounds that was followed by systematic pattern. Okay, deep breath, using your mouth only. Okay. 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 Okay, thank you very much, Ma'am Diane. Now you can now sit down. So now we're done with the procedure. I am going to summarize all the information that I have obtained during the working phase and to discuss the results with the patient to resolve any health problems or conditions as much as possible. So, okay, Ma'am Diane, we're done with your assessment. I'll be going to read the result in order for you to correct me if there's clarifications that you want. Okay? So, regarding with the surveying of your chest and respiration, there's no respiration disease or distress, and there's no sign of or problems with your oxygenation, so which results in normal and good. In examining the posterior thorax, your spine is systematically aligned, your column is straight, right and left shoulder and hips are aligned or in the same height, and of course, during the palpation of your posterior thorax, your skin is intact and your temperature is uniform. For the respiratory excursion, you have a full systematic expansion in terms of your thorax for vocal extremitus or firmitus. You have a bilateral symmetry, firmitus, and firmitus is heard clearly, which is good. So during the percussion, you have a normal results because it has no reasoning. For the diaphragmatic excursion, the vesicular and bronchal-vesicular breath sounds. So for the auscultate breath sounds, you have a quiet rhythm and effortless respiration. So in assessing your anterior thorax, it is in full systematic. During the percussing, resonate sounds, disease, breath, and you have an adventitious breath. So overall, findings all good and within normal. So do you have any questions or clarifications during the results?
None.
Okay. Okay, Ma'am Diane, we're done with the assessment. Don't forget to exercise and eat healthy so that you have a more stronger immunity. Thank you so much, Ma'am Diane, and may you have a nice day ahead.
Thank you, nurse.
So that's conclude my written demonstration of assessing the thorax.